Good morning, everyone. We'll get started in just a few minutes here and allow everyone to sign on. Good morning, everyone. We'll get started in just a few minutes here and allow Thank you so much, everyone, for joining us today. We're going to go ahead and get started, and I'll hand it off to our Executive Director, Mr. Laurent Hubert.
Thank you very much, Nichelle, and welcome back if you're a returning viewer to ASH's webinars, to this webinar for the public health community on endgame tobacco control policies, and in this case, particularly the tobacco-free generation concept. Which is an approach that would confine the sales to those born after a specific year, effectively increasing the legal age of sale by 1 year every year with the aim of creating a tobacco-free generation. We have participants from all over the world, but a large US contingency, so thank you for joining us today. I'll keep a very quick overview about ASH for those who are not familiar with the organization, but ASH was formed in 1967, and until 2000, its main mission was to protect non-smokers' rights. In 2000, it shifted its work and took a much more comprehensive and global approach to protect everyone from everyone's rights from harmful tobacco products, and protecting non-smokers as well as those who smoke from the harms caused by tobacco. And as we expanded our global approach, we took a role in supporting the development of and implementation of the Global Tobacco Treaty, the WHO Framework Convention on Tobacco Control. ASH also worked to support the concept of carving out tobacco out of trade agreements, such as, for example, with the Trans-Pacific Partnership. It also worked to integrate tobacco in the global UN development agenda. And as a lot of you know, there's a target on tobacco in the current Sustainable Development Goals. ASH operates under two principles, evidence-based and human rights-based. And now we work to integrate tobacco in the global UN human rights agenda, particularly with the UN Human Rights Council and other human rights mechanisms. And now we're also very focused and working on supporting novel endgame policies to help lower prevalence rates in the United States and all over the world. And we're particularly interested in addressing the supply side of tobacco products and really rethinking cigarette sales, looking at the retail environment and develop and support policies that can phase out the commercialization of tobacco products while also taking into account the needs of people who smoke and are addicted to nicotine. And the COVID-19 pandemic is placing the right to health front and center in the public debate, so really providing an opportunity to highlight the need to accelerate implementations of measures to decrease smoking prevalence. And this obviously means implementing the known evidence-based measures like the one included in the Global Treaty, the WHO Framework Convention on Tobacco Control, such as increasing taxes on all tobacco products, smoke-free policies, health warnings, plain packaging, banning all advertising and sponsorships of tobacco products, banning all flavorings, ensuring access to cessation, and so on and so forth. And I want to highlight that point because that's absolutely critical that governments and jurisdictions do that they implement the evidence-based measures. But it also provides an opportunity for jurisdictions to explore new ways and endgame policies to protect the health of their citizens. So I want to welcome three great panelists who will present new opportunities and new endgame policies, and particularly the tobacco-free generation concepts. And we're joined by Chris Bostic from ASH, who will briefly describe Project Sunset, which is a global movement that supports the concept of phasing out the commercial sale of cigarettes. Chris, please go ahead.
Thank you, Laurent. And welcome to everyone. Thanks for joining us today. I'm going to be very brief, just so we can get to our distinguished panelists. But I wanted to put the tobacco-free generation concept into a bit of context for ASH's programs. I've been a big proponent of the tobacco-free generation concept since I first learned of it in 2012. My initial reaction was, why didn't I think of that? And I followed closely the efforts in Tasmania to make it a reality. While it has not passed there yet, it is taken seriously by tobacco endgamers. So to put it in the context of ASH's vision, and in particular our Project Sunset campaign in particular, I'm going to refer to tobacco-free generation as TFG from now on, just to save some syllables. Like most anti-tobacco groups, ASH's vision is a world free from tobacco-caused death and disease. What may set us apart is that we have operationalized that vision in Project Sunset. Put simply, Project Sunset aims to phase out the sale of commercial combustible tobacco products. This is not to say that we shouldn't consider ending the sale of other tobacco products, but at a minimum, we need to find a way to get rid of the products that cause the vast majority of the tobacco epidemic's damage. As you may know, 2 cities in California have already passed legislation to end the sale of all tobacco products, and that includes electronic cigarettes. And several more are on a path to join them soon. But not every city or county or state or country is ready to immediately ban tobacco sales. Those 2 cities have a smoking prevalence of under 10%, which makes a sunset-style policy politically possible. But in places with high prevalence, it may be impossible and possibly undesirable to move to a sales ban in the short term. Those jurisdictions need to drive down prevalence first. There are a number of ways to do so: taxation, education, minimum purchase age, banning flavors, etc. TFG could be a powerful way to reduce prevalence in anticipation of an eventual sales ban. In particular, places with extremely high prevalence would be well served by TFG because it doesn't take cigarettes away from any existing smoker. This makes it more politically palatable than some other demand reduction policies because, of course, no one, including people who smoke, want their kids to smoke. Project Sunset doesn't attempt to dictate policy. Our campaign is to build political will to envision an end to the tobacco epidemic. Once a jurisdiction has established that will, we can offer a palette of policy options based on their unique situation. In many cases, TFG would be an appropriate part of the policy discussion. And while I have the floor, I have one request for our audience. If you work in a jurisdiction where the council or Department of Health has put a plan in place to seriously restrict the retail environment, an endgame policy, I'd like to learn more about it. Feel free to reach out to us at info@ash.org or simply make a comment in the chat window and I can get in contact with you. And with that, I will hand it back to Laurent and our next speaker.
Thank you very much, Chris. And before I introduce the next speaker, I want to remind everyone that you can type your questions in the Q&A box, which is for me at the bottom of the screen, and feel free to direct them to any of the speakers. And you can do that. You can start typing the questions during the webinar, and then there will be ample time for discussion after the presentations. I will now we will have a presentation from Dr. Jon Berrick from the Yale National University of Singapore, who's basically the person who basically developed the TFG concept. He's based in Australia at this moment, and then sent us a video describing the project, the concept. So I will let Nichelle present the video.
I'd like to thank the organizers for inviting me to speak at this webinar about the tobacco-free generation proposal, and in particular, the logic behind it. To think about this logic, I'd like to look at a couple of photographs. One is taken in Korea, where there's an underage law of 19 years, and here's a photo of somebody promoting this minimum age law. The second photo takes place in a different jurisdiction where it's clear that whatever underage law it is that they have there, it's not proving as effective as one would wish. So let's think about the relationship between these two photos. It's commonly considered that the first photo is a reaction to the underage smoking that you see in the second photo. But let's think a bit more deeply about that. Is that really the way that the causality works? So let's probe a bit more deeply and ask, who is this man? And why is he looking so cheerful? It turns out that he's actually the president of Philip Morris International in South Korea. And the question is, why is he so actively promoting something that would seem to be damaging his company's profits? Well, it's not just him, because if you look at Philip Morris USA, you find the CEO of Altria Group is saying that, yes, there should be minimum age laws. They've led the effort on it to make sure there are minimum age laws in place everywhere and that they're vigorously enforced. And it's not just Philip Morris, it's also other tobacco companies making similar statements. In fact, of course, tobacco companies have a very strong interest in getting people as young as possible to start smoking, because they know that because of it's so highly addictive, reckoned to be as addictive as heroin or cocaine, because it's so addictive that once you get somebody starting to smoke, there's a good chance that you'll have them smoking for the rest of their lives, so that you get your customer lifelong. So this is widely recognized by tobacco companies, and this quote here is from the legacy documents, so it wasn't intended for public consumption. Going back a bit further in the legacy archives of the tobacco industry, we find in the 1970s interviews being conducted, focus group interviews of 15 and 16-year-olds by Imperial Tobacco in Canada, looking at adolescent psychology, finding the importance of peer group influence, and noting that cigarettes are viewed by these 16-year-olds as a badge of coming of age, a symbol of the onset of maturity. And this finding highlights for us the first of two very important defects in underage laws. That badge of coming of age means that there's a rite of passage effect created. It's made the tobacco industry very keen to promote underage laws, because their message that kids don't smoke can be interpreted as showing that it's a good way for young people to appear to be grown up. So now we come to the second major defect of minimum age laws, and that's the confusing messaging that they send out. For example, if your underage law is, say, 18, the message that you're trying to send is that while this is acceptable for an 18-year-old, yet 17-year-olds shouldn't do it because it's too harmful. You're trying to convince 17-year-olds that they should be complying with that law. What are they supposed to believe? That there's some marvelous change in human physiology that takes place on the 18th birthday? That's not very convincing. Perhaps the impression they will get is that you have a different aim, which is merely control of youth while you can. It doesn't really matter what particular age you choose. For 21, you've still got the problem with you're trying to convince 20-year-olds. Tobacco industry exploit this by boasting that it's a legal product. You're saying it's acceptable for adults, and the impression that the tobacco industry try to manipulate that into is that it's something that's government accepted, regulated, and indeed approved. Well, what alternatives are available to these minimum age laws? One of the problems that we have to consider is that nicotine is very addictive. That means that a couple of choices are excluded. So one of those choices is laws that will oblige smokers to stop, making addicts stop smoking overnight. That is going to create a problem. It perhaps works in just one small town. You can do that because they can perhaps go to the next town. But if you try it on a wider scale, you've got a problem. The other method that is commonly advocated is concentrating on cessation, but the experience is that people will quit many times over because their cessation efforts are so ineffective. So it is actually better to channel your resources into preventing initiation. Well, the remedy that I've proposed is called TFG, or the Tobacco-Free Generation Proposal. It's an approach based on birth cohort. So to illustrate this, let's, for example, focus on the date 1st of January 2010. So if you think about it, there's virtually nobody who's born after that date who is a current smoker. So the idea then is that for people born before that date, the current laws apply. For people born after that date, then you mandate that there cannot be any sales of tobacco to such people, and that will apply henceforth. So they become, all those people born after 2010 become the tobacco-free generation. Here are a couple of pieces of evidence to indicate the likely effectiveness of this tobacco-free generation proposal. First is that you find about 100 years ago in Asia, a number of countries had similar policy with regard to opium smoking, and we've got here the figures from Ceylon. You can see that over the space of about 15 years, you had an 85% reduction in opium consumption in Ceylon. The second piece of evidence is more recent. It actually concerns a systematic review and meta-analysis that I've done on US motorcycle helmet laws. Now, you may recall that this is a rather controversial area because it's highly contested. So in some states have gone backwards and forwards between laws that mandate all cyclists should wear helmets and laws that are age restricted, only saying that those below a certain age have to wear helmets when riding motorbikes. Now, what you find is that when a universal law is changed to an age-restricted law, there's an increase in non-compliance. And in fact, it turns out that about 2/3 of the non-compliance with age-restricted laws is actually attributable to the fact that it's an age-restricted law. Well, this is a very good example of what Tony Blair, the former British Prime Minister, meant when he said that it's the signals that matter. So in the area of tobacco control, what goal should we be signaling to youth? Well, clearly, our goal should be one of tobacco control, but it should be apprehended by youth as being about tobacco control rather than seen by them as being about youth control. As WHO has pointed out, the best laws are those that shape the social norms to become self-enforcing. That means looking hard at adolescent psychology and thinking about what is going to influence their norms. I maintain that, in fact, minimum age laws don't succeed because they have this rite of passage effect. They also send confusing messaging that doesn't convince adolescents. On the other hand, tobacco-free generation approach, because it's cohort-based, it sends a signal that one would like to stop all sales of tobacco henceforth. One can't quite do that because of the fact that there are people who are addicted because tobacco is so addictive. So for those people, one has to continue with the present laws, but for those who have not yet started, let them remain part of the tobacco-free generation. So that's my presentation on the tobacco-free generation proposal. Thank you very much for your attention.
So now we'll introduce the next speaker, who has been championing the TFG approach for many years. Our next speaker is Professor Dick Daynard from Northeastern University in Boston in the United States, who pioneered litigation against the tobacco companies in the 80s and has been a tobacco control champion in the US and globally for years. And as I said, has now been championing TFG around the world. Dick, please go ahead.
Thank you, Laurent. Am I on?
Yes, we hear you loud and clear.
Fabulous. Okay, great. To begin with, and really, I'm trying to figure out what's happening with my screen here. Okay, I apologize. Jon Berrick ended his talk by talking about social norms. And of course, they're very important. I think he's exactly right on that. But let's think about the social norm around TFG, because I believe there's already a social norm around TFG in the United States. Ask almost any parent, including smokers, at what age would you like your kid to start smoking? Is it 18 or is it 21? And what answer are you going to get? I think the normal answer you get is, what a stupid question. I never want my kid to start smoking. If you're a smoker, you know how hard it is to quit and how desperately you want to quit. If you're not a smoker, of course, you don't want your kid to start smoking. That's the TFG proposal. I mean, it's thought to be this radical proposal that it's a step too far. How could we possibly consider it? It's really motherhood and apple pie, literally motherhood and fatherhood, at least, that the idea of this, to again reiterate what the idea is, that anybody born after a certain time, and at this point, John suggests January 1, 2010. So anybody born in 2010 or thereafter can never be sold a tobacco product. Never. It's not a rite of passage. It's not, are you old enough to smoke? Are you ready to smoke? Is it now a good idea to smoke or an okay idea to smoke? No, it's a terrible idea to smoke. And it's not going to be permitted. And in terms of social norms, John emphasized peer group norms. And if the peer group all understands that they're not going to be smoking, and of course that's true in the United States right now, that kids, at least on cigarette smoking, smoking as opposed to vaping, it's very out of fashion. Well, it will continue out of fashion, and so you'll have a generation. You begin with a generation, so they become 21 or whatever we're calling adults, but they're never, in 2031, I guess, will be the last year, or 2030 would be the last year in those jurisdictions that have gone to tobacco 21, that, do I have this right? I may not have this right. At some point, you're going to have a group of people who can still be sold cigarettes when they turn 21. Beginning in 2031, that's no longer true. At this point, the people who are existing smokers, and but for the possible conversion of people who begin with Juuls to and similar smokeless products to cigarettes, the numbers are really pretty low on the younger generations. But you're going to have increasing number of people, increasing cohorts who are not smoking at all. And the social norm for the rest of the smokers becomes even stronger to quit. It's no longer fashionable in any way, shape, or form. The young, cool people, young, uncool people, but younger people who are, then people who are not so young, but still the tobacco-free generation, they're not smoking. Why am I still smoking? So I think that makes it more likely, even than it is today, that they will make the extra efforts to quit. Now, in the US context, can you do it? Can a city or state do it? Well, a state can certainly do it. And based on state law, depending on how much autonomy states give to towns and cities and counties for making their own tobacco control law, local jurisdictions can do it as well. And how do we know that? Is it preempted? The tobacco companies will say it's preempted. We have a whole bunch of cases that say this isn't preempted. Sales restrictions are not preempted. It was crystal clear exclusion in the 2009 Family Smoking Prevention and Tobacco Control Act that it did nothing to restrict the power of states or localities to restrict the sale of cigarettes, presumably in any way they want. And if you wonder about the in any way they want, there was a case this week. A federal judge in California upheld the right against an attack by Philip Morris, I think it was, Altria, the right of the Los Angeles County to ban flavored tobacco products. The law doesn't, the federal law doesn't ban it. They're free to do whatever they want. So we don't have a legal obstacle here, and the wide prevalence now of age 21 restrictions, just sort of underlines that point. Jurisdictions switched from 18 to 21, and there's not even legal challenges in those cases. So I think there's no legal issue here. What are the advantages of TFG over age 21 and sales bans? Well, I think Jon made that pretty clear. I think now, so age 21, any age can look like a rite of passage. I think it has made a difference. I mean, I think I just want to clarify at least my own take on this. I'm not sure it would be Jon's, which is that the switch from age 18 to age 21 has been shown to make a difference. Now, it's already age restricted. So the notion was, we have whatever adverse effect there is from the rite of passage effect. But if you go from 18 to 21 and you do make some reasonable efforts to enforce it, then, you're cutting off 3 years when, it's more likely than anybody older than that is going to start smoking at that point. So they are effective, but they're nowhere as effective. They would, the tobacco-free generation would be, much more effective. Presumably, it would be close to 100% effective. You say, well, what about, somebody pretending, faking their IDs, things like that? My question is, why would they do it? What would the motivation be? So they look cool to their friends? I don't, by the time you're age 21, you're not trying to look older. When you're 15, you're trying to look older, but not when you're 21. So why would they do it? So, well, conceivably there could be some level of, illegal purchases and sales. It would be, I think, very minor. What about compared to the good work done by Beverly Hills and Manhattan Beach in banning the sale of all tobacco products? Well, I think, as was pointed out, there are places with already very low incidence, and it doesn't do the trick. In other words, unless this were done nationally, or at least statewide, or certainly done by larger cities, it's probably going to have relatively limited effects. Though again, the first study for the first jurisdiction that went from 18 to 21, which was Needham, Massachusetts, which is a little town in the suburbs of Boston. And it turns out several years later, when you look at prevalence, that Needham had much lower smoking rates than the already pretty low smoking rates in adjoining towns like Wellesley and Newton. So, these are effective, but again, limited applicability. And if they really did make it extremely difficult to quit, they would have downsides. And for that, anybody who's been following what happened to in South Africa, where following COVID, they announced a ban on the sale of all tobacco products. And not surprisingly, it produced a rash of bootlegging of underground sales. So that of course has been pointed to, and that's a downside, and a downside you would not have with the tobacco-free generation. But the upside, which may have gotten less attention, is that smokers, former smokers in South Africa, some very high percentage of them, I think it was something like 40%, it was a very high percentage of them, responded to a survey by saying they now intend to quit. There's nothing like being forced to go cold turkey for a couple of months to both convince you that you can do it and the advantages of doing it, and so forth. So, there's, I think the, this, arguably would be a good public health measure if it was the only one available. But with tobacco-free generation, in those places where complete ban is not politically feasible, tobacco-free generation, what's the opposition? Who gets hurt? Not even the retailers. The retailers are just losing 1% of their business or something, because after all, young people are smoking less than old people. They're losing maybe 1% of their business a year, tobacco business. So the only real enemies are our usual ones, which are the tobacco industry. Well, if that's true, of course. Oh, by the way, one other great advantage of this is that we have all these debates within the tobacco control community. Should we ban cigarettes? If you want to do, a ban of something, do you just do combustible products or do you do all tobacco products? The argument being, if you do all tobacco products and the people who are hooked don't have the other products to fall back on if they the medications aren't working for them. That's the argument. The argument doesn't exist in the case of TFG. We're not cold turkeying anybody. So it can apply to all tobacco products. No reason in the world not to include any product that contains nicotine. So whether it's cigarettes, whether it's IQOS, however you pronounce the Philip Morris thing, that got some kind of go-ahead it shouldn't have, but did from the FDA, whether it's Juul or Puff bars, no argument for allowing any of these things. They're all addictive and no upside whatever. And they should not be allowed to be sold, at least to anybody born on or after whatever the start date is, perhaps January 1, 2010. So why hasn't it happened? Well, all it would take, and it hasn't happened. And I was mentioning before the call to my colleagues on the panel that I had done a op-ed in the New York Times urging this. I think it was in 2013. And this is like the tree that fell in the forest that nobody heard or saw. Did it really even fall? It has produced nobody. I mean, Jon's advocacy of other people has produced nothing. Why not? All it would take is 1 or 2 jurisdictions in the United States to try this. 1 or 2 jurisdictions. And there would be a big uproar about it, and how could you? And then you would have people saying, why not? Why not? That would get it going. You'd have people saying, why not? There's a problem that I'm old enough and have been in the tobacco control world long enough to remember that it was thought, I was started as president of Group Against Smoking Pollution in Massachusetts in 1983. And we had this radical idea, which, and we've gotten a few communities in Massachusetts, a handful of communities in Massachusetts, to limit smoking in restaurants to one section of the restaurant. And everybody else, sort of the grown-ups, the serious people in the room, understood you really couldn't do that. Yeah, you really couldn't do that. Much less ban smoking in workplaces. I mean, we had Newton, Massachusetts was the first workplace, the first community in Eastern US to do it. And I had to go through many, many meetings, early morning, late night meetings of the Newton Board of Aldermen to Board of Selectmen to get this thing passed because it was so radical. Now, what makes a perfectly obvious measure, what we all take to be, of course, you don't allow smoking in workplaces. Of course, there isn't smoking in restaurants. Stan Glantz and I, joked about, the crazy idea of banning smoking in bars. Would anybody ever permit that? And then, of course, that happened in California. Well, nothing crazy about it. It happened in Ireland early on, which I think was very important in getting the EU to adopt a wide range of smoke-free measures. Irish pubs. So everything is impossible until it's done. And when it's done, of course, everybody knows that. Yeah. So I think that's what the problem is. So what about now? Now is the time. Why do I say now is the time? Well, any time would have been the time. But why is now especially the time? Well, we have, in the US, these 3 crises coming together. COVID-19 and the magnificently botched management, mismanagement, dismanagement of that by our president, the denial of science, the denial of public health, the notion that, gee, my common sense beliefs, whatever they are as real, more true than what, nasty little people like Tony Fauci, keep saying, all the nasty things he says. I think that has been pretty thoroughly discredited. So this is a great moment for public health. I think people now understand that public health is as important a national priority as the military. These are both critical pieces of national defense. So public health suddenly is understood to be, okay, this is incredibly important. It's science-based. It's going to involve you're having to do things you don't want to do. You don't want to wear a mask. You don't want to stay 6 feet distant. You don't want to not go to beaches. You're going to have to do things you don't want to do so that in a little while you can do things you do want to do. That'll be okay. So I think this is a tremendous model that, okay, you have to, even if you think there's some pain involved in a public health measure, if it's really important and it promises to make things much better, you suck it up. You take a deep breath and you do that.
Thank you very much, Professor Daynard. We want to make sure we have some time for questions.
Okay, I'll wrap. Okay, let me wrap it up in 1 minute. You can't be on a call in the United States today talking about crises and not talk about George Floyd. But what has that done? I mean, that has the Black Lives Matter movement, which was around and was, are you in favor of it? Are you against it? I don't know. Da, 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 da. I mean, it is now has support of something like 70+% of the American public. We're at a moment when things really can change. If you look at the political situation, the kinds of proposals that are being considered by our, dispositionally conservative Democratic presidential candidate, what's being considered? These are programs and changes that were off the table 6 months ago. A year ago, no, quote, reasonable person would have thought about a whole bunch of things, whether it's changing police practices or $20,000 a year, $2,000 a month to people, everyone in the US during COVID, whatever the proposal. These were not things that serious people proposed. This is a new moment in American history. It really is. And I urge people on the call and to urge them to their friends and colleagues to take advantage of it and finally make the important, really meaningful changes that we need. And first among them, the tobacco-free generation proposal. Thank you.
Thank you, Professor Daynard. I want to remind everyone that if you have questions, you can type them in the Q&A section. And we have a number of questions. And indeed, I think it's an important message that was communicated that things that appear radical at the beginning, and for example, smoke-free, it's true that that appeared like it was a very radical idea at one point. I even remember during the treaty negotiations for the global treaty, there was no appetite for this. We passed at almost the 11th hour, was included in the treaty, and a year later became one of the most rapidly embraced public health measures around the world. And where we have now a number of countries that have gone totally smoke-free. So same thing could happen with this. So we have a number of questions. I think an important one is about the argument of prohibition in something like this, which basically eventually leads to a full phase out of the sale of a product. So what about the argument that prohibition doesn't work? Looking at drugs, we see a move towards harm reduction and decriminalization. Is the idea that a gradual approach will be less problematic? Chris already answered, but maybe Chris, would you give that a stab first and maybe?
Sure. So I think that's exactly right. The reason for the phase-in approach that we've adopted for Project Sunset is to avoid some of those problems. It gives time for people who smoke to put quit plans in place, and this was the real problem in South Africa. Dick mentioned that they had banned tobacco sales during COVID, but COVID didn't give them advance notice, and so it was overnight, and that was perhaps the biggest flaw in the design. Nothing against the South African government. They were given a choice of essential versus non-essential, and what could be less essential than tobacco products. So that was a lesson for us that we were on the right track in terms of a phased-in approach. As I mentioned before, it's very important to start with a low prevalence. So if you don't have, you need to get the prevalence down through maybe more traditional tobacco control measures or TFG, which would work very well to do that. And then not sort of take that last step towards getting rid of the sale until your prevalence is extremely low already, and therefore there's political will. It's also worth pointing out that Project Sunset is only about the sale. It's not about possession or use. So we're not going to have cars driving from the border trying to outrun police with cigarettes in their trunk. That's just not going to happen, because if you want to grow it, if you want to give it away, that's fine. It's just going to be the commercial sale.
And by the way, on the issue of prevalence, notice that with TFG, the people who are not being permitted to smoke are people who have very low prevalence, regardless of what the adults may be doing in the community, the older people in the community. These are people with very low prevalence. They're kids or people who came up in a generation when cigarette smoking was uncool. And if they've been told early on that you're the tobacco-free generation, it's going to stay uncool. I mean, what's so hot about smoking? In other words, if you think about it as a bright idea, I'm going to wrap this thing up, breathe it in deeply, cough my head off, go nauseous, and then become addicted to it. I mean, why is this a cool idea? Only because, of its existing prevalence and the fact that the idea had not been challenged. Laurent, you're muted, Laurent.
Yeah, and actually, and Professor Daynard, actually also another question that addressed to you. You spoke about seeing an increase in people not smoking if THG is implemented, and the social norm for smokers will become stronger and push them to quit. So the question from one of the viewers is there any concern that they are further stigmatizing smokers, or is that a necessary byproduct to reduce smoking prevalence rates?
Well, I think it does not stigmatize smokers. Well, I mean, at some point, to the extent that the rates get low, smokers will, I guess, inevitably feel stigmatized. But that process has been in place for 40 years now. I mean, I noticed it in maybe 30 years ago. I lived near the John Hancock building in Boston, which is the headquarters of this huge insurance company. It's a huge building. And at some point, I noticed that there were people smoking outside. These would be the employees who would come outside. And you could see it was a mix of people from different levels of employment. So there are people dressed like vice presidents and people who, looked like, secretaries who worked in the mailroom, and they were all out smoking together. They didn't want to be there. They did not want to be there. It was stigmatized. So it's a process. The stigmatization is part of the process, the social psychological process, encourages people to quit. But the purpose of this is not to stigmatize. That's not the purpose.
Thank you. There's a question on the topic of cessation as it relates to cessation versus prevention. And so the viewer asked, how much less effective is cessation than prevention? It is significantly less effective, and in your opinion, should organizations reduce cessation efforts and just pursue prevention altogether? Chris, would you like to address this, please?
Sure, I'll start. Dick might have some thoughts on this too. We think that both are important. I know that's an easy thing to say. This is a problem with the tobacco control community for many years. The whole time that I've been involved in tobacco control, cessation has been the back burner issue, and people have focused on prevention. First, let me say they're both prevention. Preventing people from smoking is prevention, but getting people to stop smoking prevents the diseases that they would get. So they're both preventive measures. The problem is the reason that cessation is less effective than prevention is simply because it's so hard to quit. It's easier to keep someone from getting addicted than to take them off addiction. But they're both very, very important. And from ASH's standpoint in particular, since we take a human rights-based approach, we firmly believe that access to cessation help is a human right, and governments have an obligation to provide it, particularly since it's governments that allowed the sale to begin with that got them addicted. So we don't think it's an either or in this case. And in fact, it's when we work with a jurisdiction that's contemplating a Project Sunset type policy, we'll stop working with them if they say they're not going to do cessation. They have to make sure cessation is in place because smokers have rights too, and we can't just ignore their peril. Dick, do you have anything to add?
Yeah, though again, notice that with the tobacco-free generation, this does not increase the pressure on cessation services because you're talking about people who aren't smoking anyhow.
And in terms of the experience from other products, this approach has been used. Jon Berrick mentioned the example of Ceylon with opium. And it's quite interesting with opium, which actually in Asia was often mixed with tobacco and was quite a problem in the Asian regions through the 17th, 18th century. And a TFG approach was used, I understand. Could you elaborate on that, Professor Daynard?
Yeah, well, that was, I think that was the example that helped give John this idea and convince him that this would work initially. And, he was teaching in Singapore and more familiar with the Asian experience, I guess, than most of us here would be. And I think what happened in Ceylon is they did something, I don't know what age they picked, but they said that anybody who had, was not an adult in the year 1908, I think it was, however they were defining adults, cannot be sold or cannot use, I don't know how it was done, opium. And it worked. He demonstrated in 15 years an 85% decrease in the usage. It couldn't only be the people between ages 21 and 36 that was producing the 85% decrease. It had to have been a concomitant social change so that it was no longer, to the extent you weren't addicted or could break your addiction, you were incentivized, not to continue to use opium because, it's no longer a thing, right?
And it worked in a place in a society where it was actually quite prevalent, the use of opium. Then a few viewers are asking whether should it include vaping products or alternative nicotine delivery devices.
Well, I think the wonderful thing about TFG is the answer is easy. Yes, of course, because the only argument, there's nothing good to be said about these devices other than that they may be helpful in, weaning a smoker from cigarettes, which presumably are the worst, though some of the evidence coming out on some of the alternative products makes them look much worse than, people were hoping they would be, because there are other chemicals that you inhale, and typically they have not been vetted. But you don't have to get into any of these issues in the case of TFG, because you're not talking about people who are addicted. So you don't, why should you, expose them to anything that would be addictive, whether it's in whatever form it is. So this makes it easy. Now, obviously, as John pointed out, for people who were born before the critical date, let's say before 2010, then whatever is available, that becomes the whole debate that's going on, continually going on through the tobacco control world, which is what should we do with these things? And that continues, that debate has going to have to continue, but it's going to apply to fewer and fewer people as TFG kicks in.
Thank you. There is another question, and is the access to cessation, whether it's pharmaceutical or any sort of cessation support, is that a barrier to TFG or any endgame policy, such as phasing out the sale of tobacco products through other means? I think this is a very important question. I'd like you to expand on that a little bit.
Well, again, for TFG, cessation is really, the availability of cessation services is really irrelevant. What you could say is if you were doing a plan for your economy, state or national economy over the next 50 years, you would be able to say that what TFG says is that, as you go further down the line, you're going to need less and less money for cessation. You're also going to need less and less money for lung cancer treatment, COPD treatment, and so forth, because that stuff is going to be being phased out as well. But in terms of current needs, it's irrelevant. You're not talking about people who are going to need cessation services. They're not hooked now. Maybe a few of them are. And if some of them are, to the extent that some people are, yes, cessation services should be available, but they should be available regardless of TFG. Of course, they should be available for the reasons Chris said so well.
Right. I'm conscious of time, so we'll leave some of the last questions that we have here. Let me run through them very quickly. There's a few people are asking on more information on the Beverly Hills and the Manhattan Beach ordinances. Chris, would you be able to share that with the? Is there some way of sharing that information with the audience?
There is. I don't have my hands on it right now. It's on my work computer, and I'm having trouble connecting to it. But it may be possible when we send the follow-up thank you that we can put a link to those ordinances.
Laurent, you muted again.
Just trying to going through the questions. Any Shelley, the question of social sources, or this, what about the problem with social sources? And I don't know if someone in this case is referring to potentially the illicit trade of tobacco products in this context. Well, if they're not available, how will youth could they potentially find other ways or illegal ways to get cigarettes?
Sure, of course they can. I mean, any law can be violated. You know, there are laws we all take very seriously, like laws against murder, yet people are murdered every day. So the mere fact that something's a law doesn't mean, but none of us would want to repeal the law against murder, right? So yeah, I mean, the laws are going to be, but I think the incentive to violate it, yeah, I mean, there could be social sources and there could be fake IDs, would be two obvious, ways of getting around it. But why would you want to? That's the point. Why would you want to? Your generation is not smoking. You're not hooked yet, presumably, unless you're one of the small group of young people who were, in which case, hopefully, you'll avail yourself of cessation services when you discover that the great majority of your cohort, are not smoking and never will be smoking. Yeah, I mean, there's the possibility, but unlike a situation of prohibition, unlike just stopping the sales or what happened in South Africa, you're not going to get a lot. You don't have a lot of addicted smokers who are desperate to try to find some alternative source, which is really the assumption underlying worries about smuggling and black market and all those kinds of things.
Thank you very much. And I'm conscious of time, so we are just about to wrap up. So there's no time for any further questions. And some of our speakers have a really hard stop in a few minutes. So I just want to thank all of you for joining us today. We will have a webinar on August 21st in 2 weeks, August 27th, I mean, that will address environmental issues associated with the consumption of cigarettes and particularly cigarette butts. And you will hear about successful campaigns in the United States as well as Spain, where they've used environmental message to further protect humans as well as the environment from the environmental harms, as well as health harms caused by tobacco. So you will hear from Raquel Fernandez Medina from an organization in Spain called nofumadores.org, No Fumadores, and where they used an environmental approach to get smoke-free beaches in Spain. You'll hear from Dr. Thomas Novotny of San Diego State University, who directs the Cigarette Butt Project, and from the Hudson Kingston of the Public Health Law Center. So thank you so much for joining us today. And we'll hope you join us again in a couple of weeks. And thank you very much to all of the speakers.
Pleasure.
Bye-bye.
Bye-bye.